Hi everyone, Michael Giakoumis here, a sports physiotherapist based in London at Marylebone Health Group. I'm going to be talking today around recurrent muscle injuries, the problematic cases in many ways. These are the type of injuries that I enjoy seeing and often see within the clinic. And I suppose some of the common symptoms or things that people come in for is they often talk about how they've failed this rehab process a number of times, or I've seen someone who's had 8 muscle injuries in the space of 2 years or 3 years. And so part and parcel of that is really trying to get down to the diagnosis. When I say that, it's not about diagnosing that you've got a muscle injury. That's quite easy. Often you have an episode or there's tightness, there's pain and restriction in what you're able to do. So that part's the easy part. The challenging part that people want to know and what we help and I help with is trying to identify what are the impairments and the functional problems that we need to address to get on top of these things. So what we do is we take a detailed history, we understand what might have been the injury, and we marry that up with sometimes imaging. But often the time, imaging can be a report at a particular point in time. We're trying to understand where you're at now. And we do that by, again, going through a thorough and an individualized assessment that is very systematic. So we can identify the contributing factors, whether it be a quadricep injury, a hamstring injury, or a calf injury that just keeps on recurring. And these things are common. So you shouldn't feel necessarily alone but they do require an individualized approach that identifies all the contributing factors that we then put a plan around. And that could be around treatment, that we need to actually get areas mobilizing a bit better. That could be around trying to provide some stability, so some specific exercises around, or improving the conditioning and the strength of particular areas to either help that muscle, so that muscle might be weak, or we might need to address other muscles that aren't quite strong enough, aren't quite fit enough, that might increase the demand on the muscle you keep on getting injured. We often have a saying, in certain cases, it's the muscle where you're strongest, where you often can break down. So it's just balancing up whether that's the particular case or whether we just aren't strong enough to cope with what you're able to do. And so within that particular period of time, on the back of that, yes, the first 6 weeks is around identifying your problems, identifying where we're at in the stage of healing, whether you've just had it or we're 3 or 4 weeks down the line, and then trying to put an individualized program together to address contributing factors and get you back to what you want to get back to.